price of the test that weighs on people. It's the potential price of what comes after. What if this finds something, and what if I can't afford to follow through? Reporting from Bridalveil Falls and Thompson Pass, Alaska, I'm Doreen Lorenz. Dr. Sally, what are the costs of the follow-up test if something shows up?
Wow, it looks really cold there. It's so warm here. Um, okay, the question was, what are the costs of follow-up tests if something shows up, right? This is one of the most practical and emotionally loaded questions that I hear because it's not just about money. It's about the fear of the unknown. So the reality is, if a cancer signal is detected on this test, the next step is not treatment. It is to go and seek confirmation. So you would go to your physician and you could be referred for something like a CT, an MRI, or a PET scan. Sometimes it's a blood panel. Sometimes it's a physical exam. Sometimes it's a watch and wait or nothing at all. These follow-ups vary very much depending on what the signal suggests and what your history is, and what your medical team determines is the most appropriate step. So because of all of those variables, the cost can vary too, especially depending on your insurance, your location, and your access to a provider. Many follow-up tests are covered by insurance, but here's what matters most. You are never forced down a path that you didn't choose, because knowing early gives you many options, and options give you agency. You are not powerless just because a flight goes up or a smoke signal is detected. You are informed.
That really puts it in perspective. How should we think about the financial side without getting overwhelmed or avoiding the test out of fear?
Aha. Well, firstly, recognize that this test does not drop you into some non-negotiable treatment plan. It just opens up a conversation. If something shows up, we will work with a healthcare team to decide what's appropriate for you. Now, that could mean some diagnostic imaging. It could mean repeating labs. It could mean repeating this test. And just like with any other screening, like a mammogram or a colonoscopy or a blood test, what happens next depends on you. The cost of clarity can feel scary, but the cost of delay, the cost of not knowing until it's too late to treat successfully, that is a far higher cost. So if cost is a concern, I encourage patients to have a what-if plan ahead of time. Check to see if your insurance covers diagnostic imaging. Most insurance will. Check with your provider to talk about pre-approval steps for imaging and testing. You can get to know your local radiology center or get support from a test concierge. That way, if something does show up, you're not scrambling, you're prepared. And preparation reduces both financial and emotional shock. That's the real investment. Peace of mind on your terms.
That's so empowering. So, Dr. Sally, what's the best way to prepare ourselves now before anything shows up?
Well, first we put on our big girl panties and we do our adult thing and we move forward. We go to drsally.com for support on navigating our next steps. Or you can send me a DM with the word what it costs. It's actually 3 words as one on Instagram and Facebook. And we will walk you through the 3 things you can do right now to feel more prepared. 1, find out what your insurance does and doesn't cover when it comes to diagnostic follow-ups and testing. 2, ask your provider how they support patients through additional testing. And 3, set aside time, not just money, to process information calmly if something shows up. You don't need a whole plan now. You just need a little head start.
Clarity isn't about knowing every step in advance. It's about having the confidence to take the first one. I'm Doreen Lorenz, and I'll be here asking the questions that matter. Until next time, take care of yourself and take the lead in your health.